Thank you so much, and thank you for having me. First of all, I want to apologize because I did not come with any Zinedine Zidane quotes, and I regret to maybe match the Dutch vibe. So thank you so much for all the presentations and the great inspiration. I think I heard that we were trying to find a time to have a Q&A session at the end. So with that in mind, I'll try to be efficient, and I'll follow the PowerPoint I shared, obviously, but I'll go through it quickly at times, obviously not too fast, but I'll try to be efficient so we have time for questions and answers. So starting first with a quick presentation, maybe a quick background on the development of France's global health strategy for 2023-2027. There's a couple of points I wanted to highlight that you have to keep in mind when we came to drafting this strategy. First of all, was that we had in mind the idea of learning from the previous version of the strategy and to make sure that we could address the certain gaps that we noticed, including the lack of, at times, maybe ownership by different French actors of the previous version of the strategy, and the fact that different actors, ministries, civil society, private sector were working maybe a bit too in silos. So the idea was to have a bit more of a joint effort. In that regard, I think we can switch to the next slide, please. The idea was to draw an interministerial framework, being as inclusive as possible, with different ministries being involved, operators, civil society. So the strategy was drafted and led by the Ministry of Foreign Affairs, Health, and Research. All three were present when it was launched in Lyon in 2023, as well with the presence of the DG Tedros, as well as the European Commission from online. So this joint effort also took into consideration the national health strategy of France, obviously being relevant, but also, and I think that's common to every strategy presented, the EU global health strategy, ensuring that the two were coherent, echoed each other, and that the shared priorities were reflected in the French strategy. So something we'll see when we go through the 5 different priorities. And one last point before moving to the next slide was also the idea that we tried as much as possible to learn from the experience from our German and Dutch partners in their approach to global health and their strategies when influencing, drafting ours, I should say. We can move to the next slide, please. Before we dive into the 5 key priorities, just wanted to highlight also kind of the 5 ambitions, as we say, that help us guide the development of the strategy, being quite obviously working to achieve SDGs and SDG 3 in particular, reducing health inequalities, a big focus on the One Health approach, which you will see, also the idea of working to address the health consequences of climate change, and finally, the idea of promoting French expertise, values, networks, etc. So now, what are the 5 priorities in the? Yeah, you can move to the next one and then the one after as well. The 5 priorities in the global health strategy. So the first one, to the next slide, is pertains to the strengthening of health systems with the idea of working to achieve universal health coverage. As you know, or as you may know, UHC is a big priority for France, a big priority of this strategy. And in that, there's a big element about human resources in health, which, is a big challenge at the time. Currently, and I wanted to mention the WHO Academy that was inaugurated at the end of last year in Lyon, in presence of the French president as well as DG Tedros, which works to help reinforce human resources in health globally through online and in-person trainings as the academy ramps up its activity. So that's the kind of an illustration, I should say, of the implementation of this strategy and of this first objective. Now, going to the second objective, and which is promoting health and well-being with a big focus on prevention. That's the second approach taken in our strategy, with AMR being mentioned. Also, again, from a prevention, I should say, prevention angle, which is definitely key. On that, I think it's important. I should also mention it after. But One Health is already mentioned here. You may have heard that there will be a One Health Summit in France on the 3rd of November, organized in Lyon. We are still in the early stages of the preparation, but that's an important milestone for France to promote its strategy, to promote its approach to the One Health and to One Health approach and to AMR. Then the third priority being the prevention, preparation, and the response to health emergencies. So that's the third angle of the French strategy. Again, under One Health approach, the One Health approach, I should say, which is very, very key. I mentioned that regard the summit that will take place. So the idea with this objective of the third objective is to prepare and strengthen again health systems, also capacities more broadly of regional and national systems to address health crisis. Then moving on to the next one. Apologies again, I'm going quickly, but I also want to talk a bit more about the last elements, which I think are a bit more relevant for today's discussion. On the fourth priority regarding the global health architecture, I'm sure you're almost not yet sick, but we hear about this new global health architecture very, very often, and maybe now even more than in 2023. This is a key element of the strategy and overall of the thinking, I think, as Europeans more broadly, and not just in France, of thinking on how to reform, to address, or to rebuild this ecosystem to make it more fit for the current challenges, and to make sure that our bilateral, multilateral action, that the different global health initiatives and the way we support them are complementary and do not overlap, or make sure that they all address the different health challenges that they're supposed to and that we all face collectively. So that's the fourth key priority of the French global health strategy. And finally, moving to the fifth priority, this is about promoting and leveraging French research expertise and the different private and public actors that France benefits from, its scientists, its experts in different organizations in different countries, the projects being implemented on the ground through French expertise. That's definitely key, and something like a network, I should say, to ramp up and to use in a way to implement the strategy, and also to feedback when it comes to assessing how the strategy is being implemented and what the bottlenecks, gaps, issues can be through their expertise and their experience firsthand. Now, thank you for bearing with me while I was going through the strategy itself. There's a key element in the design of the strategy, which is the development of those 17 smart indicators that we used, and that we'll go through that afterwards, that we use to assess how the strategy is being implemented. I'm not going to read through all of them. I'm pretty sure there will be a possibility to disseminate this information afterwards to everyone in the room and online. I can just mention a couple of indicators to give you an idea. So the first one, being very transversal, is the assessment of the amount of ODA dedicated to global health. And then going through each priority, so priority number one on strengthening health systems, we will, for instance, assess how many countries have been supported by France in developing, implementing UHC or social protection systems. On priority two, we will calculate and assess how much support different global health initiatives will have provided, for instance, the Global Fund, when it comes to treating HIV, and compare it to the amount of support and financial support received by France to at least have an idea of how much France has made an impact in this field. Similarly, there's a calculation of the amounts of funding provided by France to projects promoting SRHR or to nutrition. Moving to the next slide, that will be the last indicators. Again, you can see on priority 3 the amount of funding provided to One Health. Similarly, priority number 4, when it comes to the global health architecture, we also look at how many projects involve different organizations, to look at how much this idea of complementarity and integration of the different actions that are carried out. So these are the indicators developed, which we believe can also serve as a good source of inspiration for potential indicators for any new or renewed strategies from European partners. Going to the next slide. So at the end of last year, we drafted the implementation report for 2023, and for 2024, it should be published at the end of this year. I'm not going to go through all of the indicators, but working with the different ministries, experts, operators, we looked at what we managed to achieve against the different 17 indicators I just mentioned. I'll give you a couple of examples on indicator 3. For instance, you have the figures there. You can see that there were 18 countries, including 9 new countries, that fund supported in implementing UHC. There's also the figure for indicator 5 on human resources for health, the number of human resources trained thanks to the support of France, and again, the amount of funding to projects promoting SRHR, also indicated under indicator 10, etc. So the idea is to use those smart indicators not only at the launch, obviously, of the strategy, but then to assess every year what has been achieved, where are the gaps, where are the bottlenecks, and how we can work, again, with this team-friendly approach. So with the ministry involved, the operators, civil society, working together, trying to think how can it be improved, how can we move forward and maybe address the issues we face in different indicators. Moving to the last slide, which I think will be maybe relevant for the Q&A. There are obviously a few points that come to mind, even when you look at the indicators. For instance, how can they stay relevant as the global challenges or the global context evolves? For instance, when it comes to indicator 1 on ODA, we can see a decrease between 2022 and 2023. When it comes to ODA dedicated to global health, particularly due to the decrease in vaccines donations post-COVID. So that's a figure that you have to take in mind, an element you have to take into consideration when assessing this figure. So it makes more sense. Similarly, when it comes to the future of global health initiatives that is being discussed now in different forums, I was at the Pandemic Fund board last where it was obviously part of the discussions. How are those indicators and more broadly our approach to global health under our 4th priority in our strategy being assessed when things are going to evolve? So something to keep in mind. And I think that will be covered by Jérôme, also using the information we just received, but the idea of making sure this strategy remains relevant to the European approach and to our different partners who have strategies, who have just released strategies such as Spain, and who may publish this in the future. And finally, one last point, the French strategy ends in 2027, so it will need to be adapted, renewed, rethought, again, being coherent with the future of the European Global Health Strategy post-2030. That's the other point to mention. I'm sorry if I spoke a bit too fast, but I tried to get as much time possible. Thank you.